Okay, Congressman, we're on our way. Good morning, folks. This is Judge Executive Al Mattingly. As always, I'm wearing my mask even though no one's here. I'm going to take it off, but I do that just to show you how important it is to use one of the tools that we have. That's being masked, social distancing. I'm in my office by myself, the congressman and I. By the way, my special guest, Brett Guthrie, he's a congressman from the 2nd District, represents Owensboro and Daviess County, is with me. Also sanitizing your hands and avoiding large crowds. So the congressman and I both are avoiding large crowds since we're in our offices by ourselves. I'm going to delay my update on what's going on in Daviess County and what's happened in Daviess County because I've got to try to be respectful of Congressman's time, and he has some things that he needs to do. So I'm going to invite the congressman to give us an update on COVID and on the vaccines. And Congressman, don't take offense if I jump in. I'll try not to, but you know how that is sometimes. So Congressman, it's up to you. Are you there or did you freeze? Congressman Guthrie? Jordan, can you hear me? I think the congressman's screen is frozen. Anything we can do about that locally?
Looks like that, Judge, it looks like he just dropped off of the feed, so hopefully we'll have him back here shortly, but you might want to proceed with your
okay.
update.
Well, folks, I'm sorry, but that's the technological age that we live in. So let me, and Jordan, if the congressman hops back on, let me know, because he's got a lot of things that I would like to talk to him and hear from him about, and I'm sure that the local folks do. Couple things. First of all, in Daviess County today, I just got the new report, and I'll read this to you. We had one new death reported in Daviess County. We had 128 new cases in Daviess County. That brings our total confirmed cases so far to 4,678 cases. Now, I don't have the final output, but as of yesterday, we had 3,305 cases of those confirmed that had recovered, and that's good news. 3,300 had recovered. We had 73 deaths in our county, and if you would take just a second to remember those folks and those families who won't have the loved one to share Christmas with. If you take the confirmed cases and subtract the recovered cases and then subtract the deaths, that will tell you that we had, as of yesterday, not including today's, 1,172 active cases. 14 of those are in the hospital currently. And Jordan, I know you're listening, so can you bring up the first slide that
I'm back.
Oh, there you go. Okay, Congressman, good. All right, I did introduce you, Congressman Brett Guthrie, 2nd District. He's our congressman. He served us well for, gosh, Brett, 6 terms, 7 terms. How long you been there?
6. It's hard to believe. Yeah. Thanks.
6 terms.
It's only 2-year terms, but it does go by faster than you think.
It does. So I'm going to turn this over to you to give us an update on COVID and an update on the vaccines.
I think I started when you were a city councilman.
You did. That's correct. It's been that long ago. Yeah.
Well, it's great to be here with you. And there's a lot of moving going around here in Washington. There's a lot of new members of Congress coming in and moving. So I think something might have happened with the server. So hopefully I'll try to speak not as faster than I normally speak, but at least fast enough to try to get through in case I go out again. But one, I know you want COVID updates, so I'm going to focus only on that. Lots going on in Washington, but COVID. The big thing for this week is COVID relief package. Leader McConnell, Secretary Mnuchin from the White House, Speaker Pelosi, Leader McCarthy, and Schumer are all meeting as we speak. I think there's a framework for a deal. One thing that from state and local government perspective, I know one of the holdups was a big kind of what some of us refer to as a bailout package or a support package for state and local governments beyond COVID. And so my idea of it is that we need to support our state, local governments, Daviess County and others on COVID related spending, but not just that. Sometimes you got to spend more money or you lose money because of COVID. So we need to focus on that as well. But it shouldn't be like the previous HEROES Act, just an open checkbook from the federal government to bail out states for, we know we have a pension problem in Kentucky, and Kentucky needs to address it. The rest of the country doesn't need to address our problem that we created before, nor should we fix Illinois or Chicago's or any of the others. So it seems there's a framework for debate that there's going to be state and local aid, but not the big bailout package. And the trade-off that the Republicans seem to have given up or may have, and Senator McConnell offered this 2 weeks ago. The fact that we're here now trying to do it is he's already offered this is we want liability protections for employers so that if they follow COVID protocols, people can't go back and sue an employer. I mean, you can't sue somebody you don't sue somebody because you got the flu and you say, oh, I must have got it at that restaurant or that store. I know some school systems that say that they've made decisions not to open because they're afraid of being sued. And so we thought liability protections would be important if people follow the protocols. So it seems like there's a framework, at least the rumors running down the hallways where I'm sitting now are, and I'm by myself as well, so I'm not wearing a mask. If I was in the hallway, I'd have a mask on. There's a framework for a deal that would be more PPP, but kind of hopefully broader. So because I know a lot of small businesses aren't really employee dependent. If you had a big employee staff, PPP really helped you. And it helped your employees more than it really helped the businesses. But a lot of businesses have been closed longer than we thought they would be. And so if you're a restaurant and your overhead and rent and utilities and stuff is bigger than your wait staff, then PPP didn't really help you get through this crunch. So this small business relief, unemployment extension seems to be there. And I know the president has really pushed on getting another stimulus payment, the checks that went out. My concern with that, every penny of it's borrowed. And some people will get a stimulus check they did before that never lost a penny of income because of COVID, but they still got a check. But it seems it's going to be a broad-based check. It'll probably be a lower threshold, which I don't know the numbers yet, lower threshold for salary. And they're talking around $600. I'm not sure what the final agreement would be, $600 per person. So that could be approved as of today, tomorrow, moving forward. So I think there's going to be a COVID stimulus bill passed, and the details are still yet to be determined. We'll make sure you keep you updated. I think the big thing that I really want to stress, and I know I talked about it last time I was on, and I'm on the oversight committee for
Brett, if you can hear me, I think you locked up again. Jordan, are you there?
Yeah, I'm here, Judge. I think we lost him again.
Yeah.
Hopefully he's able to join us here momentarily. If you want to go back to your update.
Okay, sure.
Pull the graphs up and we'll see.
And let me apologize to the folks that are watching this. These are things that are beyond our control. Is he coming back, Jordan? Okay, can you show that first graph that we have? All right, can you take my picture down? I'm sure people don't. Now, let's get my picture out of the way so that people can see the entire graph. There you go. Folks, this is something that I think that you can look at, and this is a graph of the Daviess County daily active cases. And if you recall, the way you arrive at this is you take the number of confirmed cases, you take the cases that have recovered, take out the deaths, and that gives you the active cases. And we've graphed this, and it's a graph that you'll find on our Facebook page every week. And you'll see that the graph started back on the 1st of April. And if you look at it, we did a pretty good job. There's a little spike there in May, and then it dropped back down, and then a little spike in August, dropped a little bit, and then it started to rise, and then it continued to rise from the 1st of September to October, drop back down, and then you see just an exponential rise in the number of active cases. So back in the summer, I was seeing less than 25 cases active in the community. And today, we've got somewhere around 1,100 or 1,200 active cases in the community. That's the number of people who are actively trying to get over the COVID. And this just goes to point at the amount of community spread that we have. All right, Congressman, I see you again. Jordan, get us back to the Congressman. Congressman, are you there?
Can I do, I'm sorry about technology. I apologize.
That's all right.
I
That's
just
all
want
right.
to stress, I want to say this first in case I freeze up again, but the vaccine has been approved to the same standards of any other vaccine. And I've been on the oversight of this. I've been following it since June. As soon as it's made available to me to take, when I'm in the right category or whatever to take, I will take it. And I will take it publicly. I want people to see whether it's the Pfizer. We think the Moderna is going to be approved today or tomorrow. So we're going to have 2 vaccines moving forward. And so it has been unprecedented in speed, the resources the president put into place. And there were no shortcuts. Instead of Pfizer mailing it in and it's sitting on someone's desk, that someone was sitting at Pfizer approving it for the FDA. And then you saw some concerns that Pfizer announced November the 20th. And there are a lot of people on TV saying, why do we have to wait to December the 10th? The FDA said, we want this information in the public where public people can review it and have a public hearing on December 10th. And so it is, I know some people are concerned about vaccines in general, but this vaccine is as safe as any vaccine that exists. So if you take the flu shot, you should have no concern about taking this vaccine moving forward.
Congressman, I will stand in line with you. I absolutely will be the second one to take it. I have no concern whatsoever.
Well, this is a communicable disease that didn't go away like we hoped when it warmed up. I mean, we really thought during the summer it would go away. So you're down to really a couple of choices: either eventually get it or get the vaccine. And some of the side effects have been small fever, soreness in the arm where you get the shot. That's typical of the flu shot as well. And having a small fever is far superior to getting COVID, particularly if you're in one of the risk categories. But there should be enough vaccines to get people in the risk categories, healthcare workers, through January and February. And hopefully we can get things opened up again as more of us who are healthier and younger. I'm 56 now, so I'm getting close to some of those categories. But some of us healthier and younger can take them as it comes out in the late spring.
Okay. Congressman, thank you for that. And I thank you for that testimonial. There are so many people out there that are concerned and they talk about this. It's unprecedented how fast. Well, I know this was called warp speed, right? All the resources that the United States government had went into pushing this forward. But at the same time, there were no shortcuts taken. And they
not in safety and efficacy, in safety and efficacy. Now, where the shortcuts were, and the president made this decision, and he should be complimented for it. I know nobody gave him credit for it during campaign time. What he decided was, we're going to start making these before they're approved. Right. So typically, you cannot manufacture a pharmaceutical until the day the FDA signs off, and then you start manufacturing. So we're going to have 25 to 50 million, depending on if the second one comes online, doses by the first of the year. That if that wasn't the case, if President Trump had not made that decision, we would have 0 right now as we speak. Because people keep saying, well, that's not enough. What's as many as we could make going full bore from June. I know it's not enough. We need 350 million and 7 billion because it's a global pandemic. But we would have 0 if President Trump hadn't made the decision that he made.
And we would actually be waiting to use that vaccine into the middle of next year.
Absolutely. We would be 6 months behind. We'd be 6 months behind.
Congressman, I read a story this morning. It's very exciting for Owensboro and Daviess County that Kentucky Bioprocessing has completed the design of a COVID vaccine. Mm-hmm. And now that vaccine is going to go into stage 1 trials, meaning probably take about 6 months before they go into stage 2. Tell me about that. We know there's Pfizer. We've heard of that. We've heard of Moderna. AstraZeneca was one of them that we heard about. I wasn't even aware that Kentucky Bioprocessing
Yeah, they're in game, and some of the stuff that they might want to talk about, because I don't know the science and I don't know what's proprietary to them. So I'm going to be careful, but I'll answer the question of, well, if we've got Moderna and Pfizer, why are they still pursuing the vaccine? Well, what we don't know about the Pfizer and Moderna, are you frozen up? I'm frozen up.
I'm still getting your voice. Are you there? Folks, we've lost him again. If he can come back on, that's fine. I understand if he can't. But I think what the congressman was going to say was that Kentucky Bioprocessing is going to go ahead and move forward. And some people might say, well, you're not going to inject plants into my system. Well, actually, what we're doing is we're using plants to produce the protein that are produced by other manufacturers. They're just using plant cells of plant biology to do that. It's perfectly safe. There is no issue. I would take their vaccine just as soon as I could take the other. So, Jordan, let's go on. Bring up one of those other slides, and I'll just talk about these slides individually. And if the congressman comes back, okay, let's look at the second slide, slide number 2. If you look at this slide, it's the number of Daviess Countyans in the hospital, and it's a 7-day average. Jordan, it says that you stop. Oh, okay, I've got it now. It's a 7-day average. And if you look here in December, we've averaged about 14 folks who are in the hospital. At one time, we got up in the 18, as high as 18 or 19. Remember, these are averages, 7-day averages. The good news about that is when we have a lot of folks in the hospital, that's when we typically have a lot of deaths. Now, it doesn't predict all the deaths because you have folks who are in the nursing homes and assisted living and other areas who also would pass away. But this is based on the number of folks who are in the Owensboro health system here in Daviess County. And why this is important is it's a brief snapshot of how much capacity is available in our hospitals. And we have, and I just remember right now the number of ICU beds and all of that, but we are nowhere near the capacity of our local healthcare facilities. So that's pretty cool, because in other areas of the community, you have 90 to 95% and sometimes 100% of the hospital capacity in use. So it's pretty good that we have less than 50%. Congressman,
let me just finish this point and I'll get back. I'll let you get back to where, because I apologize for the technology. But the point I want to finish is that they are in phase 1, where all these several other vaccines are in phase 3. But what we don't know is how long these vaccines will last. Is it like a flu shot where it's seasonal? Are you going to move forward? And I think what you're going to see hopefully out of bioprocessing is more of a permanent or a longer lasting vaccine. And therefore, there's still room for more players in the marketplace. Just because Pfizer and Moderna got there first, we're glad they're there. But we don't know. But what we do know, if you take the vaccine today, there are study groups that took this vaccine in June of last year. So they're 6 months ahead of us. So we're not going to be walking in this blind, not knowing if we're protected next summer, because they're going to continue to study this study group. So let's say the group that got it in June, they still have the antibodies today. So we know it's 6 months. Let's say in next June they test them and your antibodies are weak, you need a booster shot. Then all of us who took the Moderna or Pfizer or whichever will know we need a booster shot. But there are still more opportunities, more room for mass production. And hopefully Kentucky Bioprocessing is right in the middle of that. Okay. And we'll be able to move forward. In case I freeze again, I think if I freeze again, I'll have to go to something else anyway. But I just wanted to say, just like we did with Ebola and others, Owensboro should be extremely proud of its healthcare infrastructure, and particularly the work of Kentucky Bioprocessing.
Congressman, thank you for that. And I agree. I think that's one of those industries that perhaps Owensboro and Daviess County should stake their claim on as the Ohio Valley plant-based bioscience community. But in case you freeze, I want to wish you and your family a Merry Christmas and a Happy New Year. Thank you for what you do for our community and for the entire district. And I look forward to talking to you in more happy times.
Yeah, more happy times and more, hopefully face-to-face, we don't freeze up.
Right, okay.
All right. Well, thank you very
Congressman, I
much. And I
understand.
apologize for that, but I'm thanks for inviting me to be on, and wish everybody in Daviess County a Merry Christmas and a Happy New Year.
Thank you, Congressman. You're welcome anytime.
Thank you. Appreciate it.
Jordan, let's go back and bring up the third slide, perhaps. Okay, that's the second slide, and that again is the average number of people, which we're doing a pretty good job. This slide tells you the Owensboro Health % positive test results over a 7-day average. And if you look right now, this week, we're at about 14%. We were as high as 17% early on in December. That's compared to about 8.5% positivity rate on the state, across the state. So we're not doing quite as well, but also remember this is the Owensboro Health % positive test results. That means it's the number of people who were tested at Owensboro Health versus the number who tested positive. So you have to kind of look at all sides of this. What's the next item on there? One more screen, Jordan. Still looking, Jordan. One more screen.
This is it.
All right. So this is a Daviess County resident daily positive rate from the Green River Health Department. This is the number of residents that are showing up positive, and you can see where we spot. And this is average again. This is average, and you can see where we went along from April with a very gradual decline, and then we got into November, and then we got into Thanksgiving and Halloween and Thanksgiving and the holidays, and you can see how we spiked up, started to decline again. But I suspect that when Christmas and New Year's comes around, you're going to see another spike in that number. We've stayed relatively the same on the state daily average, somewhere around 63 to 65 cases per 100,000. We're in the red. Yesterday, when I last looked, there was one county in the Commonwealth that was out of the red, and I can't remember the name of the county, but that county was within one case or two cases of going back in the red. So the spread, the community spread is real. It's out there. And the issue that you have I was on a conference call with the governor today. 66% of the deaths that occur in the Commonwealth occur in nursing homes and long-term care facilities. 66% of the death. If you look at the death of those folks 60 and older and long-term care, takes 95% of our deaths roughly come from there. So that's why the first statement the governor made was the vaccines that we're getting in now, and just started with yesterday, 2/3 of those vaccines are going to those long-term care facilities. If we can get the folks who are in nursing homes and assisted living homes, if we can get them vaccinated, we're going to cut out a large number of those folks that are dying from COVID. The next step would be to vaccine those folks who are 60 and over, or those folks who have extenuating circumstances, health issues, underlying health issues. I had a question. Go ahead and move us back, Jordan. And I just started my video. One of the questions that we received was, when will people over 70 be able to receive the vaccine in Daviess County? I can't answer that. The question was posed to the governor today. All I can tell you is that what they're planning right now and how they've planned is long-term care and assisted living facilities, frontline health workers, first responders, those folks who would be right there on the front line. If you call the needed assistance, ambulance workers, firefighters, police officers, sheriff's deputies. So those folks will be on the list. And after that, I think it's going to depend on how quickly we can get vaccine into the Commonwealth. Another question, and I'm going to answer this once more. Why is there a difference in the numbers the governor reports each day versus our local numbers? It's all a timing issue, folks. All a timing issue. It won't bother me if you just follow the governor's numbers. Don't look at ours. Just follow the governor's numbers. Or you can follow our numbers. But you can't go back and forth between the two sets. As an example, if we report to the state at 4 p.m. this evening, all of our numbers, that may have changed from the numbers that I had reported to me at 10 a.m. this morning. So there are different reporting times. They've tried to kind of help that, but it don't go back and forth. If you do, you're going to get confused. What you need to look at is the numbers that we report are the most accurate numbers that we have, and they're real-time numbers. The numbers the governor reports are the most accurate that he has reported there, and they're real-time numbers for when he reports. Remember, his report is following ours by 6 or 8 hours. So anything that he gets in between is going to adjust. A question. Are the jail and nursing homes included in our local numbers? Yes, they are. Absolutely. Anything in the numbers for Daviess County are for Daviess County residents. If a Daviess Countian were to be hospitalized in Ohio County with COVID, or were to die in Ohio County Hospital or any other hospital, that number would be pulled out of that county and placed in Daviess County's numbers. So absolutely. What and I just in the report today to address some of the comments that I've heard, one of the and I'm looking for it if I can get into it real quick. One of the reasons that we were a little slow getting, it says, sorry for the delay, and then it says the deaths were, of the two, residents of Daviess County and Webster County. Then it says we are also removing a previously reported Union County death that was determined not to be caused by COVID-19. When folks pass away, there is a committee that reviews that death and reviews everything that's going on there, and then they will either deem it a COVID death or not a COVID death. Then when it's reported to the state, it goes through another committee to verify that that death was caused by COVID. I would encourage anybody else, if you have any questions right now, get them to me, because I'm about done with the things that I wanted to talk about. We're pretty far in. Again, I apologize for the technical difficulties that we had with the congressman. I've always found Congressman Guthrie to be forthright. And I think that probably the biggest promotion that you could have for taking that vaccine comes right from the congressman. He will be the first in line and do it publicly. The second biggest, I hope, will be that Judge Mattingly will be second in line, and I will stand there and take that vaccine and without any worry whatsoever. So folks, if you do have any other questions, you can email them to me here at amattingly@daviessky.org, amattingly@daviessky.org. You can put the question on our Facebook page. If there are no questions, I'm not sure that we will have one of these next week. I'm going to try to work it in, but if I don't, I want to wish all of you a very Merry Christmas, and ask you to be very, very careful when you get together in those large crowds. Protect yourself. You're the one that has the responsibility of protecting you. We can recommend all day long, but I can't stand there and tell you to get that mask on. All I can tell you is that mask do work. So with that being said, have a good day and stay safe.